Pure Plastic Surgery, home of Dr. Stephen Alexander Earle. Double board certified plastic surgeon. Ivy League educated. Named Top 10 Plastic Surgeon 2021 by the National Academy of Plastic Surgeons. More than 5,000 procedures performed. If you're looking for a boost, the answer is Pure. Call us 786-751-5585 or visit our website, pureplasticsurgery.com.
All right, hello everybody. It's Dr. Alex Earle, and we're here at Pure Plastic Surgery today, and it's Hump Day with Dr. Alex Earle. This is the time I get to spend with you guys, and of course answer all your burning questions regarding plastic surgery. So today, actually, we're here in the front lobby of what's going to be the new front lobby after construction, which is almost done. So the wall here is looking beautiful. You see the logo, and we're probably going to be filming most of these lives out here moving forward. And so what are we going to talk about today? So we're going to talk about MMO, all right, mommy makeover. I'm just going to do kind of a comprehensive live regarding everything you need to know about a mommy makeover. And of course, after that, I'm happy to answer any questions you guys may have. Okay, so MMO stands for mommy makeover, and so the first thing we're going to do is kind of define it. What exactly is a mommy makeover? Okay, because not everyone is totally sure about what that is. So mommy makeover is basically the combination of a breast procedure and a tummy tuck. Okay, that's a true mommy makeover. Anything else is not really mommy makeover. If you're combining, say, a breast procedure and liposuction, that's not mommy makeover. Okay, so the anchor is the tummy tuck, and then of course you have some sort of breast procedure associated with that. Okay, now what can the breast procedure be? Well, there you have some options. So it can be a breast augmentation, can be a breast reduction, and it can be a breast lift with or without implants. Okay, so you have all those options in terms of what to do with the breast, and then you have a few options in terms of the tummy tuck. So you have your mini tummy tuck, your full tummy tuck, or your extended tummy tuck. Okay, so you can choose or any of those as well. The most common is going to be your full tummy tuck. That involves, of course, the removing the excess skin, doing the muscle repair on the inside, and also if you have a hernia, like a belly button hernia or a ventral hernia, it can be fixed at that time. Okay, so that's going to be your full tummy tuck. Typically, the incision is going to go all the way from hip to hip. Okay, we undermine the skin all the way up to this area here, which is called the xiphoid process, just beneath the ribs, and then we are able to kind of pull all that skin down, remove the excess skin. Again, we do that muscle repair on the inside, and then we have to create a new opening for the belly button to come out. So in the full tummy tuck, you're going to have a scar around your belly button, and then of course your low transverse scar from hip to hip. That's very different from a mini tummy tuck. Mini tummy tuck has a little bit of a shorter scar, still longer than a C-section scar, okay? But you only undermine up to the belly button. You don't move the belly button around, so there's no scarring around the belly button, and there's also no muscle repair. Okay, so you can't repair the muscle, and you can't repair a hernia if it's there either. Okay, and all you're doing is removing that little bit of excess skin below the belly button. All right, that's why most patients do not qualify for a mini tummy tuck. I know we get that request a lot, but honestly, if you had one pregnancy or multiple pregnancies, if you had massive weight loss, you're not going to qualify for a mini tummy tuck for the most part. Okay. But of course, we always assess everyone. You send in your photo, you send in your questionnaire, and we'll make the best recommendation for you. Okay. Extended tummy tucks are the ones that come out. Now you start kind of turning the corner, so it's not just hip to hip, but you're also going around the corner towards the back, and that's going to be your extended tummy tuck. We typically do these for massive weight loss patients. Okay. So massive weight loss patients that's lost 100 pounds, 80 pounds or plus, they're going to have a lot of excess skin. Sometimes we do have to go around the corner there and do the extended tummy tuck. The one I didn't mention here, but it's also a possibility, but it's just not done too often nowadays, is what's called the fleur-de-lis. In the fleur-de-lis tummy tuck, you're not only having that horizontal incision down here, but you have a vertical incision up and down here, and that's really for patients with severe excess skin. If you have severe excess skin, you may qualify for fleur-de-lis. Okay? The breast, again, depends on what you need. If you need a breast reduction, a breast tuck, breast lift with or without implants. Okay? So that pretty much defines the MMO. I think everyone's probably got it pretty clear now that when we talk about an MMO, what it is. But the question that we get all the time is like, Dr. Earl, what's your quote for mommy makeover? So it's not that easy, right? Because of all these different combinations. So, the least expensive mommy makeover, of course, would be a breast dog and a mini tummy tuck. And that can be quite different than a breast lift with implants with an extended tummy tuck. So there's going to be a big range there, okay? So we can give you an approximate number, okay? But we're not really going to give you the exact number until we've seen your evaluation, your photos, and everything else, and made our recommendations. And then and only then can we give you the exact number, exact quote for your mommy makeover. And before you do the mommy makeover, of course, you have to prepare. And so once we've kind of evaluated everything, made a recommendation, you've put down your deposit, we've set your date, your surgery date now is approaching, and you're going to get a call from our pre-op coordinator somewhere between 30 to 45 days before surgery, because now you got to start to get ready. What are the things that we're going to need? Well, we're going to need your labs. Your labs are going to be your CBC, your electrolytes, okay, your coagulation parameters, so that's your PT, PTT, and INR. We also get a pregnancy test, a blood pregnancy test, okay, and an HIV test, okay. That's pretty standard for all patients. Also standard for all patients are your EKG and your medical clearance, okay. All patients are going to need labs, EKG, and medical clearance, okay. Now, if you're over 40 or if you had some sort of lung condition in the past, we are going to need a chest x-ray. And if you're over 40 and you had some sort of breast condition or a strong family history, then we're going to need a mammogram, okay? So those are only for the patients that specifically needed the chest x-ray or the mammogram there, okay? Other labs may or may not be needed depending on your other medical conditions. So for example, if you're a diabetic, we check the sugars, we check your hemoglobin A1C. If you have thyroid issues, we got to check your thyroid levels, your T3, your T4, your TSH. Don't worry about, that too much. Our coordinators will reach out to you and they'll let you know exactly what we need. They're going to give you that list and you're going to be able to give that to your PCP and they'll be able to provide all of that for us. Just remember that it all has to be here. All that information, we need all that information here at least 2 weeks before your surgery. So 2 weeks or before, all right? It cannot be within 2 weeks of the surgery. We're going to start bugging you as we get closer and closer to the 2 weeks. And if you're not being able to produce the information, sometimes we have to postpone you, okay? So we take this very, very seriously, okay? Remember, at Pure, your safety is our #1 priority, okay? And we're not going to perform surgery if we don't know exactly what's going on, and we can make sure that you're a safe and good candidate for general anesthesia and for the specific procedure, okay? So we absolutely need everything to be in at least 2 weeks before surgery, all right? What are some of the things you can't do, right? Because that's just as important. These are the things you have to do. What are the things that you should not be doing, okay? Within 30 days of surgery, absolutely no smoking, okay? So no nicotine in any form, actually. So it's not just about smoking. You can't have nicotine. So whether cigarettes, vaping, etc., there should be no nicotine in your system. We are going to check on the day before surgery. We do a urine test, and if that's positive for nicotine, the surgery will be canceled. Okay? We're very, very serious about that. Why is that? Because smoking constricts your blood vessels. Okay? That means there's less blood flow, less nutrients, less oxygenation to your tissues. That means when we're doing a big surgery like this with like breast lift and tummy tucks, the tissues can potentially, or the skin can potentially die. That's called skin necrosis. Or you can have increased risk of infection and open wounds. So it's very, very serious. No smoking, okay? The other no's, I didn't write them down here, but they're also very, very important. No estrogen, so that means no birth control within 30 days of surgery. So no estrogen-based birth control, let's be specific. Estrogen is the one that causes the increased risk of blood clots. So that's why we want you to avoid any estrogen-related birth control for 30 days before surgery, all right?
A breast procedure, tummy tuck, and some lipo. Can you tell us how long
each part of it
takes?
Well, I mean, that's going to vary a lot, right? Because if we're just doing a breast augmentation, that person's going to be about 30 minutes, okay? The tummy tuck part takes about an hour. So I wrote it here, we're going to talk that in a sec, but the procedure in its entirety can take anywhere between 2 to 3 hours. It can be really, really quick. If we're doing a breast aug and a mini tummy tuck, it can take a bit longer if we're doing the breast lift with implants and, say, an extended tummy tuck. So there's a wide range there as well. They all do include the lipo to the flanks and the waist, okay? But remember that here in Florida, we're limited as to how much liposuction we can do when we're combining it with, a tummy tuck or any procedure where we make a large incision, okay? And that's 1,000 cc's or 1 liter. So with your mommy makeover, you do get your lipo to your flanks and your waist to contour the body, but our limit's gonna be 1,000 cc's. And then real quick, lastly there, the other no is no phentermine. Remember, no phentermine for 30 days before surgery. So we talked about your clearance. So now you get here, right? You come for your pre-op day. That's when we talk. We go over all your goals, your objectives. We go over the surgical plan. We make sure everyone's on the same page. I do all your measurements. We pick out your implants, and of course, there's a ton of paperwork that we have to get through, and all that gets done in your pre-op day, which is gonna be the day before surgery. And then next day is your surgery, and like I said, the surgery can take anywhere between 2 to 3 hours. We're usually pretty quick. I never like to have anyone under general anesthesia for much longer than 3 hours, maybe 3.5 tops. But that's about it, okay? Again, it's for your safety. The longer time you're under anesthesia, complication rates may go up. There are a few things that you can add on though. So you have your mommy makeover with these options, but there are a few things that we are able to add on depending on, your physique and how much fat you have and things of that nature. So for example, if you don't have a lot of fat to remove in the flanks and the waist, then sometimes we can add on some more lipo to a small area, such as the chin or the arms. There are 2 areas where we're not removing a lot more fat, and so if you wanted to add chin lipo or arm lipo to your mommy makeover, that can be done. Or whether it's body tight or face tight. Body tight and face tight can be added as well. The other thing that we can add on is sometimes we can add on the arm lift, your brachioplasty, okay? So now that's not necessarily really a mommy makeover. Now we call it the trifecta perfecta, because now it's 3 surgeries, right? You got your breast surgery, your tummy tuck, and your arm lift, okay? But that can sometimes be added on too, if the rest of it is not too extensive. Again, what's going to be my criteria for that? I want to know that I can get all that done in 3.5 hours or less. So if I feel we can get it all done, then we can go ahead and add that arm lift. Okay?
How long after the tummy tuck can you start compressing?
All right, so we're going to get into post-op here in a second, but just before we move on, because we get this question all the time. So I talked about the add-ons, right? And people always ask, can you do the mommy makeover and the BBL? And the answer is no. So no, BBL is not an add-on, okay? And I really wouldn't recommend that. When you try to do too much at once, you basically end up not being happy with the mommy makeover or the BBL. And also your complication rates go high and go way up. Your operative time is going to go way up. So now you're looking at higher risk of infections, skin necrosis, fat necrosis, and of course DVTs and PEs, which are the clots, blood clots as well. So I do not recommend combining the mommy makeover with the BBL. But you had post-op questions, so let's talk about that. So post-op, first 6 weeks are the most important. Okay, so in the first 6 weeks, there's no heavy lifting, no strenuous activity, and also no submerging the body underwater, okay? So no swimming, all right? No bathtub, no jacuzzi for the first 6 weeks. You can take your first shower 48 hours after surgery, all right? A lot of people ask me when can they drive? Usually around kind of towards the end of 3 weeks or 4 weeks post-op, okay? At the very beginning, you're gonna be walking kind of hunched over like this. And you're gonna have to sleep in either in a recliner or with a few pillows behind your back or 1 or 2 underneath the knees to relieve some of the tension in that belly area, okay? Then you'll find that somewhere between 1 to 2 weeks, you're gonna start to straighten out, but it's gonna be a slow, gradual process there. The one thing that a mommy makeover does come with is drains. You're gonna have 2 drains for the tummy tuck aspect of it. I almost never put drains for the breast, but there's gonna be 2 drains for the tummy tuck aspect of it, and they can be in anywhere between 1 to 3 weeks. It all depends on the patient and how fast they heal, how much fluid is coming out of those drains. But it is quite possible that with a mommy makeover, you're gonna go home with a drain or 2. So you have to figure that out beforehand, okay? You gotta make sure you know who's gonna be helping you with the removal of the drains. You can do it yourself if you're up to it, or you can have just someone who's willing to do it. It does not necessarily have to be a doctor or even a nurse. It's a very, very simple, straightforward procedure. Garments. No, that was a question about garments. Yes. So for the tummy part of it, initially you're going to be using an abdominal binder, and you're going to wear that binder until both drains come out. Once both drains are out, then you can switch to your Baja type garment. For the breast, you're going to use a surgical bra. We're going to give you that surgical bra, and you're going to use that for the first week. After that, you can use any soft cloth bra as long as there's no underwires. And usually a sports bra that opens and closes in the front is the easiest. No underwire bras for at least 6 weeks, okay? Very, very important, okay? So those are the garments that you're going to be using. And here at Pure, we always give you additional DVT PE, okay, essentially blood clot protection. The biggest risk of this surgery is potential for blood clots. And so we're going to do a few things to minimize that risk. One is simply your compression stockings, and you're going to wear those for at least 7 days, so you should have more than one pair. And then we're going to give you a device called the Circulate, okay? The other term for it is a sequential compression device, or SCD. This also goes around the calf. It's compression, mechanical compression, and it keeps the circulation in the legs moving, and it greatly decreases your risk of a DVT and a PE. You have to use that for at least 2 weeks. 2 weeks post-op. You're going to use it while you're here in Miami. You're going to use it for your travel back home, and you're going to use it for another week or so back home as well. When do you use it? Pretty much anytime you're not walking. Okay, certainly while you're sleeping, while you're traveling, and while you're not being very active. For example, you're watching a movie or something like that. So extremely, extremely important. That's what I use instead of the shots. I know the next question is going to be, do you use Lovenox or shots? No, I don't, but I use that. I use the Circulate. Okay, we're going to provide that to you. You're going to take that home with you. Okay, extremely important. And even though you have all that, though, you're not off the hook in terms of your walking. All right, you got to walk at least 10 minutes every hour while awake. All right, and then at 6 weeks, life starts to getting back to normal. You can start being more active, head back to the gym. Swimming's typically okay, but the swelling is not going to be completely gone. The swelling is going to take at least 3 to 4 months for about 80 to 85% of the swelling to go away, and that last 10-15% or so can take another 3 to 4 months. It's not unusual after your tummy tuck or a big surgery like this to have swelling that can last sometimes anywhere from 6 months up to a year. Okay, and that's okay. Everyone heals at a different pace. All right, there's no need to rush it. Just let your body heal at its own pace. We've talked about all the good. You're going to be loving your results and everything else, but now we got to talk about the potential downsides, right? What are the potential complications after a mommy makeover? This is very important to know. Because the only way to have a 0% complication rate is to not do surgery. So even though we're extremely careful here, safety is our number one priority, complication rates can never be 0. The most common, or some of the most well-known ones, one would be bleeding, okay? It is possible to have a hematoma after a tummy tuck or in the breast area. If you have a hematoma, sometimes you have to go back to the operating room to remove or evacuate that hematoma, wash everything out, stop the bleeding, and close things up. Not very, very common overall. I would say less than 1%. Scarring. Everyone scars differently. Okay, some people are prone to hypertrophic or keloid scarring. What's the areas that are most prone to keloid scarring for the breast, if you have an anchor pattern, are along kind of the lateral side of your horizontal incision. And for the tummy, the most common area to scar in a keloid fashion is your belly button, unfortunately. But it's true. So we got to really keep a close eye on that scar in the belly button. We got to treat it with these silicone-based scar creams. Sometimes we have to inject it with some steroids if we feel it's getting too raised. And if it does get raised and you get a keloid there, sometimes we have to go back and do what we call a scar revision, okay, which can be done under local for most patients, so that's all we're doing. So you got scarring, okay, infection. We just mentioned that. Keep your belly buttons clean. That's going to really, really lower your rate of infection there, okay? We always give you antibiotics starting the day of surgery and for about a week after to try to minimize that risk. We talked about the blood clots. DVT stands for deep vein thrombosis. Those are blood clots in the legs. PE stands for pulmonary embolus. Blood clots that then travel to the lungs and cause serious, serious problems, okay? This is the most dangerous complication after a mommy makeover. The most dangerous complication. This is why we do all this DVT protection that we just talked about. Extremely important there. You have to be very, very compliant with this, okay? Because a PE can certainly land you in the hospital, in the ICU, and sometimes even death. All right, so it's rare, much less than 1%, but it's very serious, okay? So we do everything we can to prevent that, all right? And then prolonged swelling, we talk about some patients can take up to a year, and that's okay. It's just going to take longer for you. That's the way your body heals. And you just have to be a patient, right? Allow your body time to heal. And if it takes 12 months, then that's okay. What then is the most common second stage after mommy makeover? Okay, so I mentioned about the 1 liter limit. I also mentioned how we typically don't lipo the front of the abdomen when we do the tummy tuck aspect of it, because we don't want to create further trauma to that skin, which can lead to tissue loss, skin loss, or skin necrosis, open wounds, and things like that. So because of those reasons, the most common second stage procedures, which can be done 3 to 4 months after, are your lipo 360 and or BBL. Okay, again, I don't do them all at the same time. We don't do them all at the same time, so we stage them out, and you can stage them out. Typically, I like to do the mommy makeover first, and then 3 to 4 months later, come back for your lipo 360 or BBL. Okay, everybody. Well, I hope this was a kind of a comprehensive talk about mommy makeover here today. Should have pretty much answered almost any question you may have related to this procedure. And I want you guys to tune in next week, okay? But if you missed anything today, you can always go to our YouTube channel, Pure Plastic Surgery on YouTube. You can subscribe there. You can look at all these videos at your leisure. And we discuss all sorts of plastic surgery topics there. We have lots and lots of videos, educational videos there for you to see, okay? All right, everybody. I hope to see you all next week on Hump Day with Dr. Alex Earl. Ciao.
Pure Plastic Surgery, home of Dr. Steven Alexander Earl. Double board certified plastic surgeon. Ivy League educated. Named Top 10 Plastic Surgeon 2021 by the National Academy of Plastic Surgeons. More than 5,000 procedures performed. If you're looking for a boost, the answer is Pure. Call us 786-751-5585 or visit our website pureplasticsurgery.com.